This is a global pandemic, the worst contagious, virulent infection we've seen in over 100 years.
You must stay at home. Whatever it takes. We will beat the coronavirus, and we will beat it together.
Well, what a weekend of developments it was. The Prime Minister back at work hosting a video conference at Chequers on Friday with top advisors and making it very, very clear he's concerned about lifting lockdown measures too early because he wants to avoid a second peak. That has seen another senior minister, Michael Gove, not rule out the possibility of pubs being closed until Christmas. I can't believe it. So does that mean we've all been far too optimistic about this idea of returning to normal over summer? Dr Hilary is here. Hilary, say it isn't so. Pubs closed until December?
Listen, we've got to do what it takes. We've got to see what the case numbers are. We've got to see how hospitals are coping. We've got to see how critical care is managing the number of people suffering from COVID. We've got to see how the transmission rates are amongst the general public, which means testing and finding out. Listen, if it means that we have to wait a bit longer and be more patient, then we have to do that. Remember, this is a global pandemic, the worst contagious, virulent infection we've seen in over 100 years, which is killing hundreds of people and could kill millions around the world this year. So we just have to be realistic. We have to save lives. We have to protect the NHS. And if it means you can't go down the local until Christmas, so be it. I hope it isn't the case, but we might just have to swallow that one.
One thing that's emerged over the weekend, Hilary, which is interesting, although the government have not confirmed this is the case, but they have been presented with a traffic light plan to getting us back to normal. So the red phase would allow things like hairdressers to open perhaps as early as May, but then you'd have to wait for the green light much further down the track for things like nightclubs to open and mass gatherings like football games and concerts to be allowed again. Do you like this traffic light approach to reopening the company?
Well, I suppose the traffic light thing makes it easy for people to understand. Scientifically, when lockdown is eased and restrictions are lifted, you want to minimise the transmission of the virus so that we don't get an immediate second wave and go straight back to where we were before with the first wave. And that means that we can allow the least vulnerable people to go back to their normal activities. For example, school children going back to school. They need their education, but they're also much less likely to suffer from the virus itself. So that makes logical sense. Then probably university students, and then later small businesses where there isn't a lot of social contact between lots of people. And then later on, we can talk about bigger gatherings. But the vulnerable in our society, the people at most at risk, will still need to be shielded for some considerable time. And we just have to see what the data shows before we can allow them to be exposed to any risk that isn't otherwise acceptable.
Thousands of questions have been coming in from you. Thank you so much for that to Dr Hilary over the weekend. You can use the hashtag Ask Dr Hilary because Hills is here every weekday. First though, question from Ashley Atkins, who says, how would you advise schools, colleges and universities to go about social distancing when we gradually reopen? For example, lunchtimes, classroom settings and student gatherings.
Well, what I'd like to see to start with when the time is right is that schools can start to go back, perhaps not to the whole school, but perhaps certain age groups or certain class years can go back one at a time so that the pupils can be spaced out more in the classroom. Perhaps we use the gymnasia, maybe we use the school halls more, maybe we stagger times for school lunch and for playground time. Because we'll still need to social distance. The last thing we want is a lot of people of any age group in the same confined area, like a classroom. I mean, some schools have got, 35 pupils to a class, and clearly that's not going to be a good idea because some of them are likely to either pick up the virus or transmit the virus to others. So I think it'll be staggered, and there's no reason why university students could, for example, continue some of their studies with a lecture which is beamed to them through the internet. Rather than sit in an auditorium listening to a lecturer. So I think we'll need to be creative about how it's done.
Good advice there. Question 2, and this is something we're also worried about, the plight of our elderly. Elizabeth McLean says, how long will the over 70s have to stay away from family and close friends after the main lockdown ends?
One of the awful consequences of this horrible pandemic is that elderly people who love to have visits from their family, their children and their grandchildren have been cut off and feel even more isolated than they even were before. And I think that we just have to remember that they are the most vulnerable because of their age, because of any pre-existing conditions. If they are exposed to the virus, the consequences could be horrendous, and we do see that reflected in the cases of loss of life from COVID-19. It's predominantly the elderly, so we have to shield them more. And this virus isn't going to go away just because lockdown comes to an end. If it does, in a few weeks' time, the virus is still going to be out there. So these more vulnerable people will still need to take those precautions. And if they do have visits from their family, perhaps it should be one family member or it may be two, but with social distancing so that they're 2 meters apart. I think we'll still have to have little caveats to visits, although we could perhaps introduce those family visits quite gradually.
Hills, given the concern about the pubs not opening until Christmas, does this mean elderly people have to start realistically thinking about a Christmas that might not involve spending time with their family?
It's so difficult to plan ahead. This is such a new virus. We're learning about how it behaves within society in every country around the world, and every population in every country are seeing different things with this virus. Here in the UK, we will undoubtedly have a lifting of restrictions in lockdown at some point, and then we'll have to see how things develop from there, how the NHS is coping, how many new cases we're seeing. There is the prospect towards the end of the year, when Christmas arises, of still a necessity to protect the elderly who are most vulnerable. We know, for example, in Italy, that one of the reasons there were so many cases all at once because the Italians are into intergenerational care much more than we are. So grandchildren are often looked after by grandparents, but they were transmitting the virus to the elderly vulnerable group. So we might have to consider a Christmas that is different to Christmases we've had before and enjoyed. Hopefully, everything would be wonderful, but I think I would be over-optimistic in saying that Christmas will be normal. I think we might have to accept that visits will be limited to a small number of people, or possibly even remaining in terms of Skype messages, telephone messages, Christmas cards and the internet.
Very sad times. Question 3 from Ian Forbes. Why are there still new cases of coronavirus despite the lockdown?
Well, the lockdown, of course, doesn't make the virus disappear. There are many millions of people who are key workers, essential workers, people making deliveries, people volunteering, people on the front line, patients themselves. There are people out there, and the virus is still circulating. Now, after lockdown, the virus is still there. Those people who've been in lockdown have perhaps not been exposed to the virus. Most of them won't have been. So they're another, I suppose, a population that is ripe to pick up the virus. And there might be a second wave of the virus because of that. So lockdown doesn't make it go away. And therefore, the virus will still be there. We still need to socially distance. That will be extremely important, and we'll need to test more people so that we know who's got it, who needs to isolate, who is a contact of that person who's tested positive, so that we can make them isolate as well. And only that way will we be able to mitigate the effects of the virus in the population and enable the NHS to cope.
Question 4 has been sent to us by Raymond Singer.
Hi Dr Hilary, does COVID-19 affect organ donation, and can organs still be used after death?
Oh, it certainly will have an effect on organ donation, Dan, because, you know, if someone's signed up to give permission for their organs to be used in the case of their demise, then if they've got an active infection, those organs can't be used, because if they were, they would transmit the virus almost certainly to the recipient. So this will have a knock-on effect on organ donation. Not, of course, if someone is clear of the COVID-19 and has never had symptoms and has been tested and they've tested negative, those organs could still be harvested. But I think it will have implications on people waiting for organ transplantation, and this is just another tragic consequence of this dreadful disease.
Craig's rightly worried, Hilary. He asks, I am being asked to go back to work, but I'm concerned about my wife as she's classed as vulnerable. Can I refuse to go?
Well, you can refuse to go. How it would affect your employment would remain to be seen, because the guidelines are that the vulnerable need to isolate, but those people who are otherwise fit and well don't need to.
So the employer wouldn't be breaking the law by asking Craig to come to work?
No. If he's got no pre-existing condition, he's not in the vulnerable group, he's got no symptoms, he, like everybody else, can come back to work after lockdown if it's essential work. After lockdown, even if it wasn't non-essential work, the employer wants them back, it's within the employer's right to say, well, what reason are you staying off work? If the guidelines say that you can come back to work, then clearly there's a conflict there. Now, I can understand that he doesn't want to bring anything back home to a vulnerable person, but unless he's got symptoms, there's no reason he can't go about his normal activities, but obviously taking every precaution he can not to bring anything home, which means hand washing, socially distancing, hand sanitizer and everything else.
I know. My heart goes out to people, though, who are worried about family and friends at home, because I did all of those things, Hilary, and still ended up with COVID-19. So
exactly,
one of the only ways you can be safe is by staying home. And finally today from Julian Sammelboro, who asks, if schools do reopen while there's no cure or vaccine, should we take more precautions with our children than we usually would?
Well, as I've said, I would hope that the schools put in place measures to help with social distancing. Education is obviously important, and children are basically much more resilient than other age groups in terms of COVID-19. Precautions should be perhaps that they don't, after school, mingle in huge gangs of children, that they don't get too close to others. They go for their education and they come home. I think that's how it'll pan out initially. But the children are basically resilient to COVID-19, but it doesn't stop them bringing the virus, if they're exposed to it, back home. So I think children should be careful to separate themselves from, say, grandparents who are in a vulnerable group because of pre-existing conditions or by dint of their age. And I think those kind of precautions will certainly need to be thought about quite long and hard.
Dr Hilary, more amazing advice. And if you have anything you want to ask Britain's most trusted medic, then you can do so on social media by using the hashtag Ask Dr Hilary. We love getting your videos in particular. Or you can go to thesun.co.uk/Dr Hilary or visit talkradio.co.uk. And we'll be back again tomorrow for another edition of Ask Dr Hilary, Coronavirus Explained.